So, we are talking about full body lift. Namaste. I'm Dr. Sheetal Londhe. I'm a board certified plastic surgeon practicing at Nagar, Pune, ZeroSize. What is this full body lift and who needs this full body lift? Patients after massive weight loss have a lot of loose skin that hangs from everywhere, like the bat wings we call, the tummy aprons, the dangling thighs. These are all which are problematic areas for a patient who's gone a massive weight loss. Now, what is massive weight loss? Massive weight loss is when a patient has gone more than 15 to 20% of their total body weight. If they have lost those many kgs, then it is called a massive weight loss. Who undergoes this? Patients after bariatric surgery. They were 150, 120 kgs and then they underwent bariatric surgery and the skin started sagging because of weight loss. Very common nowadays. Lots of celebrities are also promoting it. Is the GLP-1 drugs. On these drugs, patients lose weight very, very fast, but they only lose fat and the muscle volume, but the skin, it sags completely. Okay, someone who was very dedicated and they've taken that effort that they've worked on for a year and two on a good diet and a good gymming or just walking or anything, and they lose weight, but the skin sags. So when we correct all these things, it is called as a full body lift. Now, what comes in full body lift? So the main organs that we take care of is the apron of the abdomen, then the back wing, like looseness of the skin at the arms, then the dangling thighs. These are the major chunks and the back. But along with this, we also do a breast lift and a face lift. So all these procedures put together come in full body lift. Now, let me tell you what is important in these body lifts. It's not as easy as, you just go to a tailor and tell him, I've got an XL shirt. Now please make it an M and give it to me. Even he will say, it's just not putting the stitches, but I have to cut something, I have to remeasure something and do. So similarly, when we are planning for a full body lift, now let's take the abdomen for example. Okay, you've got a big apron of the skin that is hanging and dangling there. It's not only annoying aesthetically, but there are many things that you have to tug in into some belts before you wear any clothes. Second thing, carrying it everywhere becomes difficult. There are a lot of skin rashes, fungal infections. So these all are the bothering point. When we have to get rid of them, we are going to just cut them and stitch it? No. There are many calculations that come in. What are those calculations? First, most important, as a plastic surgeon, the scar should be good and hidden. If you have scars all over the body, what's the use of doing these body lifts then? Isn't it? Because then you can't wear the clothes that you want to wear. And then comes my calculation, whether the muscles are developed or not developed underneath. If you've gone to the gym and had good muscles, then yes, those muscles need to be sure. But if the muscles are not developed, my incisions are different. Planning for the surgery is different. It's not as easy as just cutting the skin and then just suturing it. Then you'll just look box-like. If it's a male, you need to have a good macho V-like body. If it's a female, you need to have an hourglass body. And most important is the belly button. Where the belly button is going to sit after this procedure. Is this the original belly button that's going to come, or I'm going to give a new umbilicus to the patient? So these all things have been discussed and measured and done in your consultation. So just one consultation is not going to help. There are going to be multiple consultations before the day. Okay. Now, as I told you, when it comes to full body lift, the scars of the abdomen has to be hidden. The belly button has to be well placed. When we are doing a back lift, either it's a lower back lift or an upper back lift, scars have to be well placed. When we are taking care of the arms, the bat wings, the scars should be in such a line, such beautiful, that they will be most of the time hidden and not being seen. And thigh lifts, whether it's a mini thigh lift, it's a full thigh lift, whether it's a V incision or whether it is just a Y incision, all these things have been calculated. Breast lift, very important. Are we only going to do the lift or are we going to add a volume to it? If you're going to add volume to it, how are we going to add it? Either we're going to use an implant or the fat or patient's own tissues or a dermo-epidermal graft which is going to be put there and taken care of. Many things come when we are planning for a body lift. And very important is the face. Even the face sags after massive weight loss. So doing a facelift, a neck lift is important when these procedures are taken care of. These procedures can be done together if we calculate the risk and the hours of surgery. They are also been separately divided, whether the patient is fit for surgery, where we do a lower body lift first, then the upper body lift and all those things. So there are many things that happen. Just cutting the skin and suturing, it's not that easy. Whereas there are patients who come and hold the skin behind and say, ma'am, I want this result. But to give that result, I don't have to just tag your skin behind. I have to cut something, stitch something, make something sit over something and give a good scar. So massive weight loss or just weight loss, and you are bothered with that loose skin, that dangling skin, you require a good consultation for it. You should always consult a board certified plastic surgeon. If you have any query regarding your massive weight loss journey or your dangling skin, your loose skin, the ptotic breast or this face that is sagged a lot, please feel free to come. Have a consultation with us. Let us take the calculations. Both of us will sit together and decide that this is good for you, this is not good for you, this is what I can give you, these are what are your expectations are. Many things. So if you have any doubt, you want to come and talk to us, have a consultation, please feel free and visit us at ZeroSize, Nagar, Pune.